Intro. Are the medications you're taking every day quietly putting your heart at risk? In this important video, we'll reveal 4 common medications that could be increasing your chances of a heart attack without you even realizing it. These drugs may be helping in one area but could silently be harming your heart in the process. Understanding these hidden risks is crucial if you want to make smart, informed decisions about your long-term health. If you're serious about protecting your heart and staying healthy for years to come, be sure to subscribe to our channel and hit the notification bell so you never miss new tips, insights, and updates for living your healthiest life. Let's dive in. 1. Hormonal contraceptives. Hormonal contraceptives have played a powerful role in giving women more control over their reproductive health, but they're not without risks. Some forms of birth control, especially combined hormonal contraceptives, CHCs, which include both estrogen and progestin, have been linked to a higher risk of heart-related events like heart attacks and strokes. These medications come in different forms: pills, patches, and vaginal rings. But research has shown that women using CHCs have nearly twice the risk of arterial blood clots compared to non-users. To put that into perspective, about 1 in every 4,760 women using these pills may experience a stroke each year. Around 1 in 10,000 could have a heart attack. And the risk appears even higher with non-pill forms, like the vaginal ring, which was associated with a 3.8 times greater risk of heart attack. Why? Estrogen is thought to increase clotting factors in the blood, making clots, and therefore heart issues, more likely. The danger is even greater for women who also smoke, have high blood pressure, or high cholesterol. What's safer? Progestin-only contraceptives, like the mini pill, injections, implants, or IUDs, carry much lower heart risks. In fact, progestin-only IUDs haven't been linked to increased heart attack or stroke risk, making them a safer option for heart-conscious women. 2. NSAIDs, non-steroidal anti-inflammatory drugs. Painkillers like ibuprofen and naproxen are go-tos for many of us dealing with pain, inflammation, or fevers. But while they're effective, they come with a serious warning. These medications have been linked to increased heart attack and stroke risk. NSAIDs work by blocking enzymes, COX-1 and COX-2, that create prostaglandins, compounds involved in inflammation, but also in protecting blood vessels and regulating blood flow. When those enzymes are blocked, the balance between blood vessel constriction and relaxation gets thrown off. Platelet function may also be altered, leading to higher risk of clots. The FDA has even issued strong warnings. The risk of a heart attack or stroke can show up within just a few weeks of starting NSAIDs. The longer you take them and the higher the dose, the greater the risk. And it's not just prescription versions that pose a risk. Over-the-counter NSAIDs carry these dangers too. Even newer, so-called safer NSAIDs like COX-2 inhibitors, COXIBs, haven't been free from cardiovascular concerns. Several reviews, including one from the European Cardiology Review, have confirmed the increased heart risks across both traditional and selective NSAIDs. For years, the heart-related risks of NSAIDs, non-steroidal anti-inflammatory drugs, were overlooked, but that's changing. As awareness grows, it's become clear that not all NSAIDs carry the same level of danger when it comes to your heart. For example, diclofenac has been linked to a higher risk of major heart issues, including heart attacks compared to others in the same drug class. On the other hand, naproxen appears to be a safer option for your heart, with a more favorable risk profile. What does this mean for you? It means NSAIDs should be used carefully and selectively. Always evaluate a person's heart health history before prescribing or taking NSAIDs. Stick to the lowest effective dose for the shortest possible time. Monitor blood pressure regularly, especially in those using NSAIDs long-term. If you or your patient has a high risk of cardiovascular issues, it's wise to consider alternative pain relief options that are easier on the heart. 3. Diabetes medications, thiazolidinediones. Some diabetes medications, especially a class called thiazolidinediones, can also pose a risk to heart health. One of the most well-known in this category is rosiglitazone. Originally developed to help people with type 2 diabetes manage their blood sugar by improving insulin sensitivity, rosiglitazone later came under fire for its potential impact on the heart. How does it work? It activates a receptor in the body, PPAR-gamma, that helps regulate glucose and fat metabolism. Sounds good, right? But this same mechanism can also affect fluid retention and cholesterol levels, which in turn may strain the cardiovascular system. Studies have shown one 2007 meta-analysis suggested a 43% increased risk of heart attacks in people using rosiglitazone. Multiple studies agree it significantly raises the risk of heart failure. The data on stroke or overall death rates is mixed. Some studies show elevated risk, while others don't find a significant link. The takeaway: these kinds of drugs require careful consideration. For people with existing heart conditions or high cardiovascular risk, safer diabetes medications are usually the better choice. It's all about weighing the benefits of blood sugar control against potential harm to the heart. 4. Certain antidepressants. Antidepressants play a vital role in mental health, but some can also affect your heart. Two common classes, tricyclic antidepressants, TCAs, and selective serotonin reuptake inhibitors, SSRIs, have different cardiovascular side effect profiles that are worth knowing. TCAs older, powerful, but riskier. Drugs like amitriptyline and nortriptyline are effective, but they come with a higher risk of heart-related side effects, especially for people with pre-existing conditions. They can cause low blood pressure upon standing, leading to dizziness or even falls, interfere with the heart's electrical system, potentially causing irregular heart rhythms like tachycardia, rapid heartbeat, or even more serious arrhythmias, prolong electrical conduction in the heart, which shows up as longer PR, QRS, or QT intervals on an ECG. Because of these effects, TCAS should be used cautiously, if at all, in patients with any known cardiovascular issues. SSRIs, generally safer but not risk-free. SSRIs like fluoxetine and sertraline are more modern and are usually considered heart-friendlier than TCAs. But even among SSRIs, some, notably citalopram and escitalopram, have been shown to prolong the QT interval, a measure of the heart's electrical cycle, at higher doses. This could potentially lead to dangerous arrhythmias, though the risk is relatively small. Some SSRIs, selective serotonin reuptake inhibitors, like citalopram, can lead to a rare but serious heart rhythm problem known as torsades de pointe. This condition can be dangerous, which is why the FDA advises limiting the maximum daily dose of citalopram to reduce this risk. Although it's not as common as with tricyclic antidepressants, TCAs, SSRIs can occasionally cause orthostatic hypertension, a drop in blood pressure when standing, and a slower heart rate. These effects are usually mild but should still be monitored, especially if someone already has heart problems. Overall, SSRIs are often the better choice for people with depression and heart disease due to their more manageable side effects compared to TCAs. However, it's always important to consider individual risks and possible drug interactions. Decongestants and your heart. If you've used pseudoephedrine, a common ingredient in over-the-counter cold and allergy medications, you know it works wonders for clearing up a stuffy nose. But did you know it can affect your heart too? Pseudoephedrine works by narrowing blood vessels in your nasal passages to reduce swelling and ease congestion. However, this vasoconstriction can affect blood vessels throughout the entire body, not just your nose. It can raise blood pressure and increase heart rate due to its effects on the cardiovascular system. In people with controlled hypertension, pseudoephedrine can cause a slight rise in blood pressure. More seriously, there have been reports linking the use of this drug to heart attacks. It can also trigger arrhythmias, like tachycardia, a fast heartbeat, especially for those with existing heart conditions. If you have heart disease, high blood pressure, or arrhythmias, it's important to talk to your doctor before using anything with pseudoephedrine. There are other options that are gentler on your heart. Even if you're healthy, it's a good idea to monitor your blood pressure and heart rate when taking pseudoephedrine, particularly if you use it for long periods or at high doses. Also, inform your healthcare provider if you're taking other medications, as some, like MAOIs and beta blockers, could interact and make things worse. Stay informed and healthy. If you found this video helpful, don't forget to hit the like button. It helps us bring you more important health tips. Drop a comment below to share your thoughts, or let us know what topics you'd like us to cover next. We love hearing from you. And of course, subscribe and turn on notifications so you never miss out on our latest videos. Stay informed, stay healthy, and we'll see you in the next video.